Hello, all. Welcome to LTC Heroes, live by Experience Care. Those of you who have listened to the podcast LTC Heroes will know that I am a big fan of Mark Klyczek and what he's doing over at Virginia Health. I will share his podcast episode a little bit further along, but I'm excited to talk about with Mark specifically today because I reached out to him a couple months ago. I said, Mark, I'd like to have you back on the live stream, and I want to highlight someone from your team. And Mark said, I want to get Heather Duncan on LTC Heroes. So let's start with you, Heather. Welcome to the live stream, and tell me a little bit about what you do, what your role is.
Thank you, Peter. It's great to be here. Right now, I am the Senior Director of Marketing and Community Engagement. Joined Virginia Health Services about 16 months ago. So the last 16 months have really been focused on refreshing the brand. And, Mark was some new blood that came to the organization, very forward thinking. So needed marketing and strategy to do the same. So we've been very busy the last 16 months, really trying to relaunch and refresh the VHS brand.
I am always excited to speak to a marketer in long-term care, and even more so with someone who's new. I'm rather new as well, about 16 months. So I'm interested in and I'll ask you first, Heather, what has been the biggest learning curve for you in getting the long-term care and bringing over strategies from other industries?
Well, the acronyms, as with any company, learning the new acronyms, also understanding Medicare, Medicaid, just all of the policies. It was all a whole new learning experience for me. I came from marketing and advertising for retail and for fast service and for food production. So then to come into healthcare, it was a very new experience. The good news is that I am surrounded by a great team, and I am not afraid to ask a question and say, well, what does that mean? What is that acronym? Why do they do it this way? Why did you say that? So we've got a great team here, and they've been very helpful in trying to get me acclimated and up to speed. So
I'm happy you said that the first thing was acronyms. I feel like you and I should write a Wikipedia of acronyms for marketers in long-term care, and it would get a lot of hits every single year for those of us who are joining.
Right, exactly.
Mark, I want you to tell me about, how you found Heather, your first impression, and how you joined forces, and why you brought a non-long-term care and converted her into a long-term care lover. I know that I'm putting words in her mouth, but she probably wouldn't be on this call if she weren't one.
Yeah, no, finding Heather was amazing because not only has she had experience in very large retail settings that are national, they all have national brands. But she was local too, so that was really great. And she does have some healthcare in her marriage, at least, right? So she has to listen to it from her husband, who's in the health system from here. So that's positive. But we really needed a fresh approach. Our approach was very paper-based, like newspapers and that type of stuff, and it was really driven by one person. And I myself don't have marketing experience and expertise, and watching Heather work and the skills that she has is just amazing, how she's able to not only put together a proposal or a marketing plan, but how to really maximize and get the most out of it. And maybe we could talk about it later, but one of those things where she really maximized the potential was we were a national campaign for the American Healthcare Association. For
jump in.
Why you should like long-term care and why it's a good thing, and Heather really turned that into an awesome piece for us as well.
Well, I want to pause on that because I have a follow-up question, Mark. And since Heather and I were vulnerable and we said that a year ago we didn't know anything about long-term care, I want to know, what have you learned, Mark, about marketing? Is there anything, new items in the budget that Heather has brought up and you're like, I don't even know what that is? And now that you've seen the fruits of her work, you're like, I might not have to know what it means, but something's working.
Yep. No, she's really taught us how to use digital very well, and how to not only use it for one aspect, but really be able to pivot off of digital and use it for many different situations. I know she had just shared with me a new term today. I forget what it was, Heather, where it's either pixelated or when someone goes to our website,
Redirecting.
well, redirected, but then I think we leave a pixel on something
Oh,
or
yes,
something.
we leave a pixel so that we can redirect and serve up the ad.
Right.
Thanks, Mark. You're not the only person who's going to watch this going to be like, what does that mean? I'm going to call Mark. No, don't call Mark. Call Heather. Heather, can you give me an example of something that you walked into very traditional at Virginia Health, and you said we need to change this? Are you playing with Facebook ads, with Google ads? Are you doing all of your recruiting online? Can you give me some examples?
Yes. So when I joined Virginia Health Services, it was very much a traditional marketing calendar, traditional media mix, not much of a digital presence, not much of a social media presence. So immediately rolled up the sleeves and said, okay, we need to start looking and getting our feet wet into the digital arena. So the pay-per-clicks, getting Facebook pages set up for each of our nursing homes, for our independent living community, our assisted living community. But then we also have different lines of service, home and community-based services, and home health care, rehab, and hospice. So setting up Facebook pages for each of them, also doing digital display ads, doing paid social as well as organic social. So it was trying to move us into that direction. And it didn't happen overnight because certainly that was going to be jarring for everyone. So we still kept our newspaper ads, but it was gradually moving those dollars away from traditional into more the digital realm. There was a lot of TV, just not much digital. And we really needed to be out there because part of coming on board was Eric and I did a lot of research to understand who are our customers, how are they consuming media, what is the best way for us to reach these consumers. So there was a lot of that going on to make sure that, we were making the right decision and shifting to more of a digital landscape versus the traditional.
Could you give an example of a channel or a campaign that is starting to work well for you?
We just recently launched a new website. So here, another example is when I joined the organization, we had 8 different websites. One for the Arbor's Independent Living, one for each of the assisted living. So obviously that was really hurting us in SEO to have VHS with 8 different websites. So a lot of research, a lot of hard work went into getting us to one website with different landing pages. So now we are in the process of really getting the word out there that, everything that you need is right there at your fingertips on the vahs.com website. Believe it or not, the old website wasn't even mobile enabled. You could only view our website on your desktop. So we have a mobile and tablet enabled website. So we're really pushing the fact that, hey, everything is right here on your phone. Find everything you need from independent living to home health care, to assisted living, to our skilled nursing facilities and long-term care facilities. So we're really pushing that now. It launched about 4 weeks ago. So it's a matter of directing everybody back to our website using Google Analytics to see what pages they're staying on and how they're navigating the website, which we really couldn't do before with 8 different websites.
Yeah, you've obviously been busy. Mark, doesn't it feel great to have a website you're proud of?
Oh.
Yes, it's amazing. And like Heather was saying, it's the families from the nursing homes are communicating to us through the website too. So whether they have issues, whether there's been good things, like we just hired a new chef at our independent living, so we've been getting good feedback on that. Yeah, it's been great to have a great website.
Heather, I want to go back to your comment about kind of defining. There's a bunch of different words for it. Defining your avatar, your ideal customer. What did you discover in that process about identifying that person, where they are, their age, or the way they want to communicate with you? Is there insights you can share with me?
Well, we did quite a bit of quantitative research. We did a lot of psychographic research also. So yes, you can have all the numbers and know the age, the median household income, their zip codes, but it was also getting inside their head with the psychographic. So what hobbies do they enjoy? What kind of cars are they driving? Where do they like to shop? What TV stations do they watch? So really trying to understand not only the quantitative, but to get into their head and understand why they make the decisions that they make. So that was very fascinating. But then we started, we took all this information and then started putting together our value propositions. Who is this consumer that we're going to talk to? And then we took it a step further and developed personas for each of these. So we have a persona for our independent living consumer. We have a persona for our assisted living consumer, and on down the line. But we thought it was important and it made it relatable. So if we're in a meeting talking to leadership, it really helps personalize it and helps them understand, okay, so for independent living, our persona, it's Jim and Pam. Okay, would Jim and Pam like this decision that we're going to make? Are they going to react to this promotion that we're running? So doing personas has always been successful and worked well for me in the past. So we kind of brought that thinking to VHS. And that then led us into, our marketing strategy, how we want to position the brand. We did new naming conventions. We did a whole new brand architecture. So the first 16 months has been very busy of, like I said, rebuilding, refreshing, and just kind of developing a new framework for the organization for marketing.
Heather, one of the things that I love about getting into long-term care is taking a unique mission and vision and values is easy to build a story around it, because there's a lot of people in long-term care that are doing amazing things and you can feel it in the mission and vision. Is there anything that when you showed up and you started working with Virginia Health Services, you're like, oh, this makes sense. Let's turn this into something tangible. Let's turn this into a video. Let's turn this into a differentiator that you remember getting excited about?
Well, I joined during COVID. So that was an interesting time to join long-term care during COVID. I think, what the big aha for me when I got here is what's unique and what's special about Virginia Health Services is that we have a spectrum of services, no matter what kind of lifestyle, whether it's you're ready for independent living, we have that. We have assisted living. We've got, our skilled nursing homes. We've got long-term care, but we also have our home health care, hospice, and rehab. So we can really speak to a broader audience. Because, no matter what kind of, where you are in your aging process, we've got something there to help you live your best life.
Mark, I'm interested in your opinion because you obviously sit in on, strategic development. You obviously speak to the board. What are the areas of growth in marketing that you've done, that you have felt Virginia Health Services grow the most? And then where do you need to grow the most in the next 18 months?
Well, I'll actually go all the way back to what you had mentioned earlier, Peter, which is the mission statement. And so we totally redesigned our mission statement and made it very simple, which is helping individuals live their best life. And through that really is driving everything. So is the way that we're growing home care, helping individuals live their best life. And when we talk about individuals, we mean our staff, the patients we serve, the family members of the patients. So what I'm really excited about having a person like Heather on board is during COVID, the tagline I like to use is, we came out of COVID with clarity, not with cobwebs. So we have a direction now, and we have a really clear way to grow all the different aspects of VHS because of the new vision, values, and strategy that we developed while COVID was happening around us. And if we didn't have the talent that Heather brings, we probably wouldn't have been able to do that and manage with COVID at the same time. So I see a lot of growth in helping people stay at home, stay out of nursing homes for as long as possible. And when they need us, that we're growing in the areas that they're going to need us, whether it be dialysis or wound care or other services. So we really want to make sure that wherever you're staying with us, we're helping you live your best life at that point.
I appreciate the insight, and I think that your more vision statement is exciting. It's simple. That clarity makes it something easy to get behind. Heather, I find as a marketer myself, I find when I get to an organization, I like to identify the differentiators that the company or the organization is doing a great job at, and then which in terms of expressing them in marketing. And then also identify the differentiators that you're good at executing, but they haven't been explained well. Can you give any insight to either one of those from what you're working on in either executing and expressing it, or something that you've already been doing well and you showed up to it?
We're working on finalizing, believe it or not, the 2022 marketing plan, and really with a focus on independent living and assisted living right now, and trying to build a census there. But it's also promoting the entire brand. So yes, VHS had a presence in the community. A lot of people knew, of Virginia Health Services in the community when I got here, but it was, are we reaching the right audiences for it? So are there some things that we can be doing differently so that even more people know about Virginia Health Services? And I think they had also done a great job of promoting themselves as a locally owned and operated company. And we find that that's important to our residents. So, they had already laid that groundwork, that they were known as and had a great reputation in the local community. So things like that made my job a little bit easier because there already was brand recognition out there, but it was a matter of, okay, let's make sure we're using the right media vehicles to reach even more people to spread the story of VHS.
I like what you said specifically about local. I've worked with a number of different local organizations, and sometimes you get in the trenches and you realize that that specific differentiator goes a long ways for your brand. Before we move on, and I'm going to ask you about Mark's leadership and also talk about his podcast, because I re-listened to it. I sent Mark a message on LinkedIn this morning. I went back and re-listened to his podcast. It's one of the most listened to. And I want to take a moment and thank the EHR company that backs LTC Heroes, Experience Care. Head on over to www.experience.care to see one of America's oldest and best EHRs today. In transition to that, Heather, Mark is an eloquent speaker. If anyone hasn't listened to his episode, go over and listen to him, where we talk about predictive outcomes. Very, very easy to understand. Very, very fascinating what he's doing there. I'm interested in him as a leader. Can you tell me something unique, the way that he runs his meetings, or the way that he runs his planning with you, or the way that he encourages you, empowers you? What's Mark like as a leader?
He's a great leader. He's very inspirational, and he's the kind of leader, I think he's put his faith and trust in me that I know what I'm doing in marketing, and is kind of letting me build this new marketing path for Virginia Health Services. Now, obviously, it's my job to keep him in the loop and let him know what we're doing. But I do appreciate the fact that, he's very hands off. He hired me as his marketing person, and that's what I'm here to do, to help the company grow and achieve all of the results. But he runs a great meeting. There's a lot of very open dialogue during the meetings, good conversation. We're constantly, I have no problem walking by his office if I have a question or need help with something. So, he's always there. He's always available. You can text him if you have a question about something, but it's very refreshing. So I'm enjoying it. I enjoy working with Mark.
Fantastic. I would assume so from my knowledge of him as a distant acquaintance in these times of COVID. Mark, I've been to a number of conventions in the last 2 months, and staffing crisis comes up over and over and over. Are you all doing anything in marketing to help you all with staffing?
Yeah, actually, Heather and I were talking about that today as it relates to the 2022 plan. And recruiting is 100% in the plan for the entire year. Using digital the way Heather's using it, she could probably talk to some of the statistics a little bit better, but the number of impressions that we're getting and the number of views from the target audience and the number of people that are actually clicking through are very good using digital. You have there's no such thing really anymore as it relates to paper advertising for recruitment. That's just not an option. So, so you have Indeed and you have other things, but we're trying to take it to the next level. We're trying to maximize LinkedIn and Instagram. I know Heather's using too for us, and those are things we didn't really even have active accounts with. Yeah. So she's done a great job of improving our social presence across a bunch of different platforms. But I'm very excited about how we're marketing to a very direct consumer that wants to be an employee with Virginia Health Services, and we're trying every day. We're actually trying to make it more direct as to memory care or what's really the purpose or the passion that's going to drive someone to apply to Virginia Health Services. You could be an LPN anywhere. Why would you want to be an LPN at Virginia Health Services? What's different about us other than too many patients and not enough money that everybody says they get in long-term care? So yeah, where's the passion and how can we help and deliver that passion?
Heather, can you speak to a specific campaign related to staffing and recruiting that you are optimistic about? Is there a type of video that you think is getting better conversions or better impressions that you think is going to actually bring in and improve the staffing situation for you all?
Something that's actually we've started doing about a month ago that we find is working very well is we have employees. Let's say I'm looking for a social worker. So I have a social worker out there that's been with Virginia Health Services for 10 plus years. So I want to hear her story. So we send a list of questions like, talk about what's a day in the life and why did you come to Virginia Health Services and how are you making an impact in the lives of our residents and their families every day. So they answer those questions. They send us a selfie. We put it on social media and away it goes. And we boost it. And we're seeing some great impressions just from doing something that simple. Now, that's not the only thing we're doing. I mean, certainly we've got a full-blown digital campaign out there. We're doing the programmatic. We're doing the display. So I see that as more top of funnel and building awareness for, yes, Virginia Health Services, here's who we are. Yes, we have open positions, but then we can utilize Facebook to get more bottom of the funnel so that when they see the story, we've got a link directly in that post. You click on it, it's going to take you to that specific job posting. So there's a lot going on. We can't just rely on the organic social. It's got to be working in tandem with what we're doing with all of the paid social as well as the programmatic and display. So, but we're seeing some good results from that. In fact, I've had other individuals in the organization that have open positions saying, "Hey, I'm looking for an IP nurse. Can we do the same thing?" So we're going to utilize that and see how it goes.
Thank you for going into the nitty-gritty and some of the specifics. I would love to have you back on in 2 or 3 months after you have some results, and maybe we could do a campaign breakdown and share it with the rest of the industry. Not everybody has a leading marketer like yourself who knows how to plan this out, or even some of the technical details. We can help the rest of the industry. Because I'm sure Mark knows this, we're not competing against other long-term care facilities. We need to bring people back from fast food into long-term care, those passionate CNAs, and they need to see why this place is rewarding. I appreciate you both joining me on LTC Heroes Live to talk about what you all are doing in marketing. If you haven't heard Mark's podcast, go listen to it. Heather, thank you so much for joining in and sharing some of your knowledge. Mark, thank you so much.
Thank you for having us.
See you all soon.